Kia ora koutou, good afternoon everybody. Last night we received notification that a worker at the Grand Millennium Hotel in Auckland, the managed isolation facility, had tested positive for COVID-19. The test was done as part of our regular routine surveillance testing, and the worker and their family immediately went into isolation at their home. We've since had the rest of the family tested. 3 have returned negative results and 1 is under investigation. That person returned a weak positive result, and further work is being undertaken to get to the bottom of that today. We've started the contact tracing process, and Dr. Bloomfield will have more details on that shortly. I do want to be clear that while this case is connected to the border, we do see it as low risk to the community. Contact tracing, further genome sequencing, and that's all well underway, and we'll update you when we get more information on those things. I want to stress that the result was picked up during surveillance testing, so this is the system working as we intended. The person concerned works in an environment that requires diligent use of personal protective equipment, PPE, and regular cleaning. From the contact tracing so far, we've identified that there's been very limited exposure. A final point to note is that the worker concerned remains asymptomatic. This all bodes well. However, we are not being complacent. We need to continue to move quickly to mitigate any potential risk to the public, regardless of how low we consider that risk to be. So it's a good opportunity for all of us to remember that our public health measures, alongside our border measures and our vaccination program, continue to be incredibly important. And everybody, as always, has an important role to play in our COVID-19 response. Things like washing our hands and sanitising regularly, whilst it's become a little bit of a cliche, this continues to be an important way for us to stop the spread of the virus. Coughing into elbows and, of course, staying home when sick. Using the COVID Tracer app to scan into all of the places we visit and making sure that Bluetooth is turned on. These are all things that every New Zealander can do to help us stop COVID-19 in its tracks. All of these measures will help us to protect ourselves, our friends, and our families, and our wider families, from COVID-19. So I'll now hand over to Dr. Bloomfield for a bit more detailed information, and then we'll take your questions.
Thanks, Minister. Kia ora koutou katoa. Just continuing on from what the Minister said, some further information about the positive case reported last night and the household contact who returned a weak positive result and remains under investigation. So today we are retesting that family member and are also running the whole genome sequencing on both case A and the second family member. We should have those results available later today. They will help us determine what, if any, link there is between the MIF worker to recent cases at the Grand Millennium Hotel. Since the 1st of March, there have been 8 cases of people in managed isolation at this hotel. It is our largest managed isolation facility, so there have been 8 cases. All were identified on day 0 or 1 of their stay, which shows the value of our day 01 testing, and of those, 5 were in that sort of 2nd or 3rd week of March, which is the time that we might have expected this case to have become infected if it's linked, as we expect, to one of these cases. Should note case A and the family member both remain asymptomatic. Case A was at work yesterday, wore a mask for the duration. There were 2 colleagues who worked closely with case A. Both are now in self-isolation, and the case did not work for the 3 days prior to yesterday. Auckland public health officials are supporting the family's welfare needs and are arranging or speaking with family members about moving to the Auckland quarantine facility. They're also working rapidly to confirm case A's likely infectious period. Case A was on fortnightly swabs, and the last surveillance swab was taken on the 4th of March. The case had also, as I think you're aware, received the Pfizer-BioNTech vaccine as part of our border worker vaccination program. The first dose was on the 23rd of February, and they had just received the second dose on the 16th of March. I have one confirmed location of interest. This is the Mount Roskill Countdown, which was visited briefly by the case for around 10 minutes on Saturday, the 20th of March. More detail will be provided on the website, the Ministry of Health website, and anyone visiting the countdown in Mount Roskill at around the time that will be indicated on the website, it's just been confirmed, needs to be alert for COVID-19 symptoms. If they develop those, of course, to stay at home, contact Healthline about getting a test. Any other new locations of interest associated with case A, or if we confirm the second case, will be notified as the information is confirmed. And just a reminder, the symptoms to be aware of course, are cough, fever, shortness of breath, sore throat, sneezing, runny nose, temporary loss of smell, and of course, as we've seen in more recent cases, muscle aches. Now, on vaccination, as noted, the new case had received both doses of the Pfizer-BioNTech vaccine as part of our wider vaccination program. It's in fact pleasing to see that this border worker, along with over 90% of other border workers to date, had been vaccinated. The second vaccine had been given just on the 16th of March. We know the vaccine is effective at preventing infection, preventing severe disease if a vaccinated person does become infected, and also there is emerging evidence for it preventing transmission. Now, full vaccination is classified as someone who has had both doses and 3 weeks apart, and a period of at least 7 days after their second dose. And that's when we would expect 95% of people to be protected, in other words, to be immunised as opposed to vaccinated. This issue of how effective the vaccine is at preventing spread or transmission of COVID-19 is one we are looking at continually. I spoke this afternoon to our Chief Science Advisor, Dr. Ian Town. There's intense work and reporting on this around the globe, and essentially the evidence has been updated daily. At this point, he says the key thing we should be taking away is this vaccine is highly effective at protecting individuals, and seems to be doing a good job of protecting people collectively when higher rates of vaccination are achieved, as we're seeing in a number of countries around the world. So it remains critically important for all of us to take up that opportunity to be vaccinated. There is now an online tool on the covid19.govt.nz website that allows people to look and get an idea of when it is likely they will be offered the vaccine. Further to the border-related case, the one we're reporting, and that case under investigation we've just talked about, there are 3 other new positive cases, all in managed isolation, and 1 historical case to report. So the rolling 7-day average of new cases detected at the border is 5. 1 case is recovered, so our number of active cases is 68, and our total number of confirmed cases since the start of the pandemic is 2,112. We've had a total of 41 historical cases since the 1st of January, and out of a total of 300 cases. On the laboratory testing, there were 2,754 tests processed yesterday, reflecting the Sunday volumes, and the 7-day rolling average is 4,438 tests. I think I'll leave it at that, Minister. Back to you.
Thank you. We'll open up for questions.
Has the family been vaccinated?
No, they hadn't yet been vaccinated.
From the contact you've had, or from the contact the Ministry have had with the case, are you confident that that PPE was used appropriately throughout their time at the Grand Millennium Hotel?
Look, I can make an observation around MIQ facilities in general first, and then the specific case investigation. We regularly review the use of PPE and other infection prevention and control measures in our managed isolation facilities. The most recent review of this particular facility was done in January. It came back with some very mild to moderate recommendations for improvement. That's the case with almost every one of our infection prevention and control reviews. They come back with further improvements that can be made. There was nothing in that review that sort of rang any alarm bells to say actually there's some problems here. It was just the usual continual improvement cycle that we would expect, and that looks at things like whether PPE is being used appropriately. So the fact that the IPC audits weren't flagging up big concerns in that area, gives us confidence that the PPE and the IPC processes were being followed and were being used. In terms of the case investigation, nothing here has come back to suggest that there were any failings in that regard.
How likely is it that this case will lead to a change in alert levels?
Very, very, very low at this point. We would need to see some additional factors that we're certainly not seeing any evidence of at the moment. I do want to be clear, again, we've covered this ground a little bit before, but our first resort when we get a new positive case is not necessarily to look to alert levels. That's the sort of response that we would use where we're seeing transmission or when we're concerned about potential transmission within the community. There's no evidence to suggest that that's the case here.
What kind of procedures are being undertaken at the Grand Millennium now that this case has emerged from it?
So obviously there's a contact tracing process that goes on within the Grand Millennium. That includes looking at positive cases that have been at the Grand Millennium and trying to identify whether there are any epidemiological links or genomic links between the positive cases that might have been identified there, making sure that all of the staff testing is up to date and any close contacts with other staff members have been identified and any appropriate steps that need to be taken will be taken there. The Grand Millennium is one of our biggest, it is our biggest, in fact, managed isolation facility. It's served us very well. We haven't got concerns around the way that operates. But as with everything, you always have a good, thorough look at any positive case just to make sure that any risk around that case has been well contained. And that's what will be happening at the moment.
Dr. Bloomfield, can I just repeat, the last swab that he took before this one was March 4, is that right?
Yes.
Is that appropriate, like for that line of work, whatever that it is this person does? That's 19 days ago. Like, shouldn't they have been tested more regularly?
Yes, so this person was on fortnightly testing. The swab, the fortnight came up last Thursday. There was a good reason why the person wasn't swabbed then, personal reason, and got that swab a few days after it was due, but hadn't been back at work and had that swab on Sunday before returning to work on the Monday. So there was a reason I won't go into, but certainly this is someone who has been regularly swabbed, is on that fortnightly schedule. The other point I did want to make is this case has routinely used the NZ COVID Tracer app, again, which is very helpful in terms of our ability to push out notifications to anyone who may have been at places of interest at the same time.
Are you able to say what their job was, like just generally?
Yes, this person's a cleaner at the hotel.
Do we know what variant this border worker has yet?
Not yet, no. We're expecting to get that either later today or early tomorrow. The genomic sequencing process takes some time. Yeah.
Are you expecting that it's likely transmission through surface fomite infection, or
Too early to draw any conclusions on that at this point. So the investigation process will look at any epidemiological link and any genomic link. Now, obviously, those two things go hand in hand. So if we identify a genomic link, it may well help us to identify a potential epidemiological link. We will review CCTV. My understanding is that the CCTV upgrade at the Grand Millennium is almost complete. There are still a couple of cameras that haven't been installed, but most of them have been installed and are operating. So that will certainly help us. It gives us visibility of most of the common areas in that facility, and that will all help with the investigation.
what's the status of its air conditioning systems, airflow? There was obviously that effort to change up how the MIQ's air systems work due to the possibility of airborne transmission.
So I'll make a more general comment first, and then again, if Dr. Bloomfield might have more on the Grand Millennium in particular. Desktop-based reviews have now been done of all of our managed isolation facilities to look at their systems. Those are supplemented where there's a good reason to, as there was in the Pullman, with people going and doing physical inspections of those facilities. I haven't got the most recent update on the Grand Millennium, but from what I understand, the desktop review certainly was completed of that. I don't know whether
I don't have any specific information, but we can find that out.
Yeah.
Don't know, but we can find that out.
Yeah.
Were you able to get genomic sequencing from all of those 8 cases that have been in that hotel?
Yes, we were able to, and actually associated with those 8, there were another 2 family members in similar bubbles, or in different bubbles, 2 family members that also subsequently became positive once the family had moved to Jet Park. But we do have the genome sequencing on all those cases, and so that will be very helpful once we have the whole genome sequencing on our new case. Sorry?
All those 8 all moved to
Yes,
Jet
that's
Park.
routinely they go to Jet Park either the day that the test result comes back or the following day. But remembering that all were day 01, identified at day 01, and people remain in their room until the results of day 01 testing is returned.
So we typically do those transfers when it's safest to do so. So if we get a result late at night, for example, we'd leave those people in their rooms until the next day and then transfer them the next day. But generally speaking, if someone tests positive in that day 1 testing, they wouldn't spend more than one night in the MIQ, in the managed isolation facility that they have been assigned before being transferred to the quarantine.
Can you just update us as to where your where saliva testing is for such workers so that they can be tested more frequently?
I'll ask Dr. Bloomfield to make a comment on that, but perhaps just briefly before I do, we have been making saliva testing available in these facilities. It's all about the calibration of the results of that to make sure that they are as reliable as a PCR test.
Yeah. So at the moment, the saliva testing is happening at our quarantine facilities. It's available to staff and is being trialled there still, but at the moment we're still maintaining our weekly or fortnightly PCR nasopharyngeal swab testing. I should say that the saliva testing is also PCR-based testing. It's just a different sampling method. But we can come back to you on with an update on where the saliva testing, how that's going in our quarantine facilities.
Dr. Bloomfield, a team of New Zealand researchers has taken a second look at that bin lid case from the Christchurch MIQ, and their conclusion is that it was airborne transmission that was the sort of vector for transmission, not the bin lid and surface infection. Have you read that study, and what were your thoughts on it?
Yes, well, I haven't read the study. I've read the summary of that study. I think over the last month or two, in particular, probably 3 months, there's been much more emergent evidence about the importance and the significance of airborne transmission of coronavirus and being a way that people become infected. And I think if we look at our more recent cases, the role of airborne or aerosolized transmission has been much more likely to have been the cause. And I think if we then retrospectively go back, knowing what we know now, it was probably more likely that the person who we initially thought it was through fomite transmission on the rubbish bin lid, it was aerosolized particles in the corridor. And I dare say that a lot of the actions that have been undertaken over the last month or two have been explicitly designed to reduce the likelihood of people being infected through aerosolized transmission, particularly by reducing movement of people outside of their rooms at the same time.
I think it's interesting, as someone who follows the international developments around this very closely, we're one of the only places in the world that's even having this conversation about fomite transmission or aerosol transmission, because in most other places it's still person-to-person transmission, and it's still hundreds if not thousands of cases that they're dealing with every day through that person-to-person contact. Because we don't have community transmission in New Zealand, we're quite unique, and as Dr. Bloomfield has pointed out, each new case we get actually helps us to understand a little bit more about the previous cases that we have dealt with.
On the new MIQ case, has an exposure notification been sent out for the countdown, and have any been sent out through the Bluetooth tracing portion?
My understanding is that the notification for countdown is going out. I'm not sure whether it's gone out as of right now, but my understanding is that it will do.
Yes, just confirming the time and therefore the period for that exposure notification to go out.
If this person who was infected at the Grand Millennium was a cleaner, have you had assurances or sought assurances that they're still getting paid? That one of the outcomes of this won't be financial hardship for the family?
Look, we work very closely with these hotels to make sure that they are treating their staff well. That's part of MB's ongoing contract negotiations with the hotel. I'm happy to come back to you on the specifics, but certainly our expectation is that staff will continue to be paid and treated well if they contract COVID-19 and are recovering from it, or if they're having to isolate for whatever reason because of COVID-19, that they will be treated well. And that's something that we build into the discussions we have around contract renewals with the hotels. It sits in that same basket as things like the living wage, for example. We want these facilities to be good employers because we know that good employment practice, again, helps us to reduce the level of risk that there might be associated with them.
Could you just give an update on how many border workers have been vaccinated and how many people are getting vaccinated every day now?
So the most recent numbers I have in terms of total vaccination, we have now administered 38,808 vaccines. That's as of midnight last night. 4,658 of those were second dose vaccines, so about 34,150 first dose vaccines. We're working on a more granular update around our border workforce. We know that it's above 90%. The feedback I've had that we have had from the hotel manager at the Grand Millennium is that they're comfortable that they are well above 90%. But there's a data matching exercise that goes on here just to make sure all our data sets are lining up so that we can get that more granular information, even by facility, of exactly where that fits.
Do you have a sort of average of how many vaccines are being given a day at this point?
So we're sort of in the low 2000s now and trending upwards. So we are expecting that to continue to trend up over the next week or two.
And how many vaccinators do you have, and is that enough for your upscaling plan?
I can get you the exact number of vaccinators. I'm just trying to find out whether I've got it on the list that I have in front of me. But we're well into the thousands of vaccinators who have done that training that's required.
And that's enough at this point?
For what we're doing at the moment, for groups 1 and 2, yes it is.
And is there any issues around supply with needles at this point?
Not that I have been made aware of.
No supply of needles. We've got a good.
Yeah. Joe will come. Joe.
Dr. Bloomfield, it's 1 year today since the announcement was made about going into nationwide lockdown. Just wondering, what's your sort of enduring memory from that time, and is there anything in particular that you would change about your own response over the last 12 months?
Well, the one thing I would do differently, I say, is I would keep a record, a personal record, because it was all such a blur. Things were moving at pace. The other comment I would make in response to the first part of your question is my main recollection about when that decision was made and then communicated to the public was I don't remember people saying why. People understood why, and my sense was there was a collective sigh of relief, and people said, okay, what do you want us to do? And the message was quite simple then: stay home, save lives, be kind. And that was so successful, people embraced that so widely that we, I think, exceeded what we set out to do. But I do personally recall a sense of relief, because there had been this real anticipation that things were starting to escalate, and we could see where that was heading overseas. And I think we made the decision in a very timely way.
Just to come back on the question around vaccinators, I can have done some maths. Over 2,200 people have now completed the vaccinated training. Of that, though, we're looking at about 300 to 400 of those who are active vaccinators at the moment, which means that we don't have an availability of workforce issue. In fact, we've got plenty of vaccinators available, so that's not a constraint for us at the moment. Audrey, we'll come back to Audrey.
Is the other family member who's got a weak positive a school child?
No, it's an adult member of the household.
We'll come over here, over there.
So just going back to your reflection from previous months, in June you said that there wasn't enough evidence on long-term effects of COVID. The World Health Organization is saying that it's become a highly significant issue. What's our position now? How concerned are you about these long-term effects?
I think there is clearly emerging evidence about the long-term effects of COVID with some people. We've actually commissioned some research into this to follow up a cohort of people in New Zealand. Obviously, it's quite a small group in New Zealand who have had COVID, but we are following up to see what the long-term any long-term health effects are. And again, I think this supports the approach we've taken by trying to minimise COVID in our community, because we don't want to take a risk either with acute infections and the impact of those, but also what can be. We know many infections for some people do have long-term chronic impacts, and we're still learning about this. So we are doing that specific bit of research in New Zealand to follow people up.
On that, what's the Ministry of Health doing for those who are actually suffering at the moment from those long-term effects? I mean, are we giving them information on the COVID website? Like, what sort of information can people get who have those issues?
I don't know exactly, but we can come back to you on that.
Are you concerned that when people at home hear that someone's had 2 vaccinations and has still caught the virus, that it's just going to fuel anti-vax conversations?
Look, we know that we've still got a degree of vaccine hesitancy out there, and of course we're going to continue to share fact-based information so that people can make informed decisions for themselves. The vaccine, there is no such thing as a 100% effective vaccine, so with even the most effective vaccines, there is still a residual degree of risk. I think Dr. Bloomfield's already outlined for you, some of the science around that, and I'm sure he'll want to add to that.
Yeah, I mean, just to comment here, a 95% effectiveness rate for this vaccine is very high. The annual flu vaccine is about 60 to 70% effective. So, notwithstanding that, that still leaves 5% of people. And one of the ironic things here, or sort of feels counterintuitive, is the higher our vaccination rates get, the more likely it is that any infections we get in the community will be amongst vaccinated people, just because most people will be vaccinated. I should also just reinforce that this person had only had their second vaccine a few days before they returned the positive test, and we generally will say people are likely to be protected or receive that full protection from the vaccine 7 days after the second vaccine. So it shouldn't discourage people.
Should he have been at home then? Like, if it takes 7 days, why don't you just tell him to stay at home and wait out the 7 days until he's reached that 95%?
So all our border workforce are continuing to work, even though they're vaccinated, and they are continuing to be tested regularly, and they're continuing to use PPE as they always have. So the vaccination is another layer of protection. And one of the very pleasing things is, as the Minister's mentioned, already over 90% of that border workforce has been vaccinated, which is very high uptake and very pleasing.
But we will get to the point in the next few weeks where people won't be doing these higher risk frontline roles unless they have been vaccinated. We are not at that point quite yet, but we are certainly getting close to it. And conversations are happening with the relatively small number of people who have yet to be vaccinated to make sure they are vaccinated, or if they are not going to be vaccinated, to look at redeployment of them to different areas where they're not in high risk roles.
When a trans-Tasman bubble opens, will you be looking to reduce the capacity of their managed isolation system?
So I'm working through that with MB, who are running the MIQ facilities at the moment. We are likely to increase the contingency that we have, bearing in mind that with thousands of people travelling across the Tasman, we need to be able to respond to any events on that trans-Tasman route. We would not be in a position where, if we needed to respond quickly, we could simply start re-isolating through MIQ everybody coming in from Australia. But we may need to do that on a more targeted basis, and so therefore having some contingency available for that is something that we are looking at. We've then got to look at what the overall risk profile is. Now, at the moment, people coming in from Australia are very low risk. If we replace a proportion of those with people from higher risk countries, we will therefore see a higher proportion of positive COVID-19 cases across the MIQ network, and we need to just understand a bit more about the risk profile of that, what that means for the workforce, and so on. And so we're working through that at the moment, but I would not at this point guarantee that all of the space that's made available from a trans-Tasman bubble will be re-released again.
So you're saying to mitigate that prospective risk, the total number of available MIQ spaces may shrink?
Yeah, so we've been doing some work around cohort allocation and so on. All of those things that we've talked about before have an operational impact on MIQ facilities. And as we look at higher concentrations of risk, then we would look at doing other things in order to try and mitigate that risk.
For people who are overseas right now and thinking about how they could come home though, I mean, what does that mean?
The trans-Tasman bubble is still good news for them. There will be more capacity available in MIQ as a result of trans-Tasman, as a result of free travel across the Tasman, but it might not be a one-for-one match. Well, certainly, I think it's highly unlikely to be a one-for-one match.
So it's most likely that the overall capacity of the system will shrink?
Whether we see any facility closures, that's not so much the question, it's more how we use the facilities that we have and whether we have more of a buffer and whether we do different things around how we allocate rooms.
There's only
So we're working through that at the moment.
Someone who's tested positive, a person has tested positive in MIQ on Sunday, and their contacts who had been on a bus with them that day and 2 days prior, going to and from a park for a walk, have been, had their stays extended. Do you have more details about when that person tested positive? Because newsroom's been told that the person tested positive while they were on the walk. Officials were told they had tested positive at that stage, but they were still put on a bus with other people and brought back to the MIQ facility.
Yeah, so my understanding was that they had their test before they departed for their regular exercise. The test result came in whilst they were, engaged in their regular exercise. I've had feedback that the bus journey, all of the appropriate measures were in place, so people were distanced from one another and so on whilst they were on that bus. They are keeping some people in for an extra few days. It fits into that abundance of caution category. I've always been very clear with the people operating the MIQ facilities that I will always support them making decisions to be cautious when it comes to this sort of thing rather than have regrets later. And so that's exactly what this case falls into. It's them being very cautious and I absolutely support them doing that.
Should those guests have been, who weren't, who are now contacts, should they have been put back on the bus after officials knew that they were going on a bus with someone who had COVID-19?
That's one of the things that we'll look at as to whether there needs to be a different operation. This is a pretty unusual case. It's not the sort of thing that you would expect to see a lot of, particularly because it was reasonably late in the person's stay as well. So this is something that we'll look at, whether if that happens again, and again, it's highly unlikely to happen again, but in the highly unlikely event it did, whether we would have a dedicated transport to pick that person up and take them back so that they weren't getting back on the bus with the other people. But like I said, the feedback I've had so far, and again, the investigation process will confirm all this, is that on the bus, everyone was appropriately distanced, wearing their masks, and those protective measures were in place.
Isn't it just common sense to be like, well, this person has COVID-19, let's not put them on a bus with other people?
Look, again, I haven't had the full report. There is an investigation report that happens after any incident like this. Once I've had that full report, I'll certainly share any lessons that have come out of that publicly, but I just need to give them we only got this information in the last sort of 24, 48 hours, and so as soon as we have more, we're happy to share that.
There's only a single
Given,
Joe.
just off the back, given you've got this new working group that's now giving you real-time advice on lessons learned, have you had any yet?
No, actually, I'm meeting with the chair. I think it's tonight. I'm having my first conversation with them about what they've encountered so far. They've only been a few days into it, though, so you do have to give them a little bit of time.
There's only a single vaccination centre open for household contacts of border workers in Auckland, in East Tamaki. And some people have said it's kind of hard to get out there sometimes. It's hard to fit it around your schedule, especially because these aren't border workers. These are university students, partners. Are we going to be opening more centres, or are we just sticking with the one?
The answer is yes, absolutely. I don't know whether Dr. Bloomfield's got a bit more of a timetable, precise timetable, but absolutely over the coming weeks you'll see more and more vaccination centres opening up.
Yeah, there will be more of the larger community vaccination centres, plus more a range of other ways that people can get vaccinated, including through Māori and Pacific providers and in other places where they'll be able to be vaccinated.
Have you heard about any kind of lingering bugs with our online scheduling software? So some people who've tried to schedule, we have a staff member who's eligible, she tried to schedule her jab and it gave her an appointment in 20 minutes. That doesn't really make sense. Is this something that you're aware of and trying to fix?
Yeah, look, the booking system is new. And obviously in this early phase of the vaccination campaign, we were dealing with a relatively smaller number of people. It is a good opportunity to iron out any kinks with the system like that. I would argue that's a very, very effective system. It's actually been too effective if it's giving you a time allocation that's too quick, so you don't actually have time to get there. So those are the sorts of things that get ironed out with a system like this. But we want to make sure, and this is one of the reasons why we're being careful with the scaling up, to make sure that as we scale up, all the systems are in place, everything is sustainable. So the last thing we want is to be scaling up and scaling down and chopping and changing all of the time. So we're working through to make sure that everything that we're doing is really robust. And that is the opportunity just to iron out those minor technical details which frustrate people unnecessarily.
So is that scaling up the reason why even though I think it's over 2,000 odd people have been trained as vaccinators, only 300 or 400 are actually working at the moment. Is that part of that ramping up so you don't run out of vaccine too early and have workforce sitting around? Or?
Yes, there's a degree of that, so one of the things we're trying to do is avoid a sort of a big dip in the middle of the year where we end up sort of running out of vaccinations or vaccine doses. So we're being very careful to not get to that point. As we ramp up, we want to sustain the levels as we ramp up. So I don't want it to be a roller coaster. I don't think anyone wants it to be a roller coaster.
The woman who stayed at the Grand Millennium in January, who's come out and said she laid 2 complaints about seeing security talking to people without masks and in close proximity. Is that something that came up in I think you said the last review was in January, and is that...
So I had a bit of a report on that just before coming down here today. My understanding is that there were 2 incidents in question. One was where are we? They weren't ones that I was particularly concerned about. They do get investigated, so they're deemed to be low-risk breaches. One involved a security contractor, one involved a wellbeing coordinator. My understanding is in the first of those cases, masks were worn, there was sanitisation immediately after the event happened, no further action was deemed to be required. In the second case, there was no physical contact, masks were worn by all participants, and there were no further actions required. So where those complaints are made, and the woman did absolutely the right thing if she was concerned, raising the alarm, raising a concern. Where those concerns are raised, they are thoroughly investigated to make sure that any risk has been appropriately managed. All right, any further questions? Well, last question up the back.
Can I just ask, if you had started vaccinating earlier, would this case have been avoidable, or at least 95% avoidable?
I'll ask Dr. Bloomfield to comment on that.
Yeah, it's very hard to say. We will continue to see cases, and that doesn't mean there's a failure or any problem. It's not a vaccine failure. It's not a border failure. The important thing is, to reiterate, we're maintaining everything we had previously, but we're also adding this additional layer of protection in for our border workforce, and that's helping protect the rest of the country.
All right. During the afternoon instead of waiting for tomorrow?
Oh yes, if there's pertinent information, important information that we need to get out there, we'll absolutely release that as it comes to hand. And Dr. Bloomfield and I will be back tomorrow with an update on this, but also some more detail on vaccinations tomorrow. Thank you.